Good morning, everybody. I'm really very happy to be here. This topic that I'm going to address today has its roots in PCL at Shenzhen. Worked with them, and that's where many of these ideas started taking much better shape than they were earlier. So, it is very nice that I'm talking at this conference, which has its roots in this area, and describing my work. So, the topic today is of great interest to everybody: AI for societal and planetary health. So, we all know that artificial intelligence is very powerful. But we also know that with great power comes great responsibility. And because of that, we have to start thinking, what should we do with AI? What should be its real application? And in that process, we cannot ignore trying to solve the problems that are most important to us all. We do not want to solve trivial problems, so we must identify most important problems. And once we have identified those problems, we have to think, how are we going to solve this important problem? So, with respect to this, luckily for us, World Health Organization and United Nations have already worked together to identify those problems. They call them Sustainable Development Goals for 2030. And these goals have been identified, and they have been working on these goals to solve this problem. So when we start looking at this, we identify that there are many problems that are interrelated, that are related to each other, but most important, they are all very important humanity related problems. So let's today look at least some related problems that could be very important. So when we start thinking about this, the most important problem that we need to solve is the health related problem. Health is the most important thing for everybody who is living. And because health is so important, can we look at health using artificial intelligence? Let's call it health intelligence or something like that. Okay? So, the first problem that we face when we try to solve this problem is health is important. We all know about that. But what is health? And how do we go about it? This problem appears to be obvious, but it's really not that obvious. The situation is, when we are living in the common world and air is in supply, we start thinking that air is just something that's always available. We don't even consider that. Like these fishes in water here, they don't know what water is. That's why Thomas Fuller some time ago said that sickness is felt, but health not at all. So the question is, how do we address this? All over the world, people talk about healthcare. Healthcare is the most important problem. But healthcare is broken in every country. Every country. Why? When we start thinking about this, we find out that chronic diseases are the most serious health problem. Today, 7 out of 10 deaths take place because of chronic diseases. We all complain about healthcare costs. 86% of the costs for healthcare go to chronic health. They are related to chronic health. By the time we detect chronic health, it's too late. The correct approach to solve chronic health is to prevent them. And as you will see, these are situations which can be prevented. So, coming to this problem, we want to start thinking about the problem that goes from individual to society and to planet, because we are going to see that all these things are related. One very important thing to realize when we start thinking about this is that the two things that are really meaningful are individuals and planets. We talk about societal health, we talk about society, we talk about countries, we talk about different organizations, but those things are artificial constructs. The real things are individuals and planets. Society is a different way of segregating individuals. So, when you start thinking about health, health are very closely intertwined. As you see in this diagram, there is an individual, and from individual we start talking about public health. From public health we start talking about global health. Then we start considering all other living beings in the society or in the world, including all the trees and all other living organisms, and we call them one health. Finally, there is the planetary health. Planetary health is considering how the planet is growing. Okay? When we start considering this, one thing to remember is everything is connected to everything else. We need to understand and build this interconnected nature of society correctly. So, when we start seeing this, the first thing is, what is health? World Health Organization long time ago defined health this way, that health is a state of complete physical, mental and social well-being, and not the absence of disease or infirmity. They also required that we consider the enjoyment of the highest attainable standards of health for the whole world as the requirement. Let's consider that and start seeing whether using AI we can solve this problem, or whether there is a real problem. After 75 years, what is the state of current health care? When I feel sick, I go to a doctor. Doctor performs all kind of measurements, and based on those measurements gives me some prescriptions. After that, I am on my own. Nobody follows what is going on. If I am really sick, I will be admitted to hospital. If I am extremely sick, I will be sent to ICU. Yeah. And I start thinking there has to be a better way of solving this problem. So I ask myself a question: when do we get the best health care? Almost in every country. When we get the best health care is when we are about to die. That time we are put in ICU, intensive care unit, and in intensive care unit all the biomarkers are measured and monitored continuously. One or more nurses are attending, monitoring those things and taking action as required at every moment. Doctors are available to take right decisions. And I start asking a question: can we put everybody as soon as they are born in ICU? Because the current health care follows a very simple repair model. In repair model, when something is malfunctioning, you measure all the characteristics related to that, and based on that you identify what disease is there and what needs to be done. This is the model that's used to repair cars, to repair to computer, to repair plumbing in your house, and to repair you also. But a big difference is in healthcare, you follow the repair model, but unlike in all other situations, you don't get cost estimate and you don't get guarantees. Healthcare people have privileged positions where they don't need to use any of these things. So you start thinking, what is going on here? Is this the right way to deal with our health? And we realize that health is a journey. It's not a situation in which you consider that you are at a destination. And when you are dealing with the journey, what do? We use a navigation model. Navigation plays very important role in every journey. We have maps which has all the knowledge. We continuously identify where we are going, and based on that, we take actions. So let's look at this, how navigation has been progressing. In the last 15 years, navigation has changed dramatically. At one time, we used to look at maps and used to struggle with those maps to get to anywhere. I can say that navigation was as primitive as healthcare is today. But suddenly something happened. We discovered that we can put all the knowledge on computers. We can also use GPS to find out where a person is, and that resulted in these navigation systems that also closed the loop, unlike the open loop in the repair model. Now all that you required was to continuously measure the GPS and take the person, and by giving them very simple instructions, turn left, turn right in 100 meters, you will have to turn now, so be ready for that, and things like that. Yeah. Now today, nobody can live without navigation systems. Today, we are in danger that our next generation, our kids, will not know what maps are, how to look at the maps, because navigation systems are continuously helping them. We realized that there is enormous power by putting knowledge in clouds, making it available on mobile phones, because then right information, right guidance can be provided at the right moment in the right form to everybody. Just think, this simple idea has changed the society. How many applications we have today, starting from food delivery to different distribution mechanisms, things to transportation. We are talking about autonomous cars and all kind of things. Can we do something like this? My dream is to empower people for personal health. And in this empowerment, what I want to see happen is to build something called a personal health navigator. What this personal health navigator do? It will guide you to better health. Remember, better health. Yeah. It will use real-time information to redirect you around a disease. Right now in Delhi, I was talking to my driver who drives me in complicated situations in Delhi city, and he said, I know Delhi very well. I don't need to find directions to go to from one place to other, but I use this navigation system only to find where is the crowd, which road I should take, because some roads are jammed, other roads are available. So always trying to find out which road will help me to get in the fastest amount of time. We should be able to do this so that you can get real time information and this guidance whether you are a professional athlete making millions of dollars or you are a taxi driver. And that is the goal that we want to follow. Remember, health is a navigation in multidimensional space. The space is not simple 2 or 3 dimensional. The space is going to be hundreds or thousands of dimensions, and the situation is very complex. You can start considering that in this space there are regions like lakes and gardens and buildings and roads and all these things. They can be labeled as situations that needs to be avoided or that are desirable situations and can be labeled as diseases and healthy situations. Yeah. Your goal may be to be in a particular health situation because you want to be able to play some game. For example, I want to start playing tennis. I haven't been playing tennis for last 4 or 5 years. How can I start playing that tennis? My system can determine what is my current health state, and based on this current health state, it can determine if I want to start playing tennis, how do I do that? And this starts giving step by step directions to that. This is purely a navigation system that will do for health. What is required? Determining my health at this moment. And what else? Well, let's see that. This is the Cybernetic personal health navigation model. We already saw in the repair model how people were doing, but now let's add to this a goal. Where do I want to be? I want to play tennis. And the situation knows, based on all the continuous measurement, what my current health is. I make a continuous loop, continuous feedback loop to make it a cybernetic system, because I'm going to give guidance to you and I'm going to monitor whether you follow guidance or not. How you are doing under that guidance. Is that guidance effective or not effective? And I'm going to do this only for you, because you are different than anybody else. You are unique. So in order to do this, I built this kind of system. This is a cybernetic system. It considers what is your goal. It considers you as the model, and it's doing continuous measurements. What are the health factors that should be considered in providing you guidance? Well, World Health Organization found that what makes you healthy depends 10% on medicine, 20% on genetics, 20% on environment, and 50% on your lifestyle. Notice these numbers. 10% on medicine, 50% on lifestyle, 20% on environment. That makes it 70% under your control. And if you consider epigenetics, then it makes it more than 70%. Let's just say 75%. So 3/4 of your health depends on your lifestyle. How do we spend our money? We spend 88% on that 10%. And we spend single digit numbers on our lifestyle. Very disturbing situation, because our lifestyle considers food, activities, stress, rest and relaxation, and other factors. In fact, in this, long time ago, Hippocrates said, "Let food be thy medicine." That was the most interesting statement. Can we start considering this and build a system? This is the system that we have been building. Part of this was being implemented at PCL before pandemic hit. We continued little bit after that, and then we had to discontinue because of the pandemic. Hopefully, we can do something like this once again. And as you see in this diagram, there are all kind of measurements being performed that are resulting in this measurements there. We are also able to build the model in the green color. All the knowledge about the situation, what kind of medicine is available, what are the local rules, what kind of facilities are available is stored in the blue thing. System can estimate based on all this measurement what is your current health state, ask you what is your goal, and based on this gives you guidance. It's nothing but a recommendation engine. It observes what you follow, what you don't follow. If you don't follow something, it can inform your doctor, it can inform your family members because it is observing the situations. It will find the correct way so that you will follow the rules. In this situation, as I mentioned, there is a goal, there are personal models, there is the estimation, there is knowledge, and these are the action items. Food, activities, sleep, stress, and medicine. So, let's look at what we should do. This is Maslow's pyramid of basic human needs. In this, Maslow identified that food is one of the most important things because food is energy, nutrients, and enjoyment. But unfortunately, food also suffers from maximum amount of disinformation. According to these scholars, about 80 to 90% information related to food is disinformation. And because of this, you have to start thinking little bit more about food, which happens to be more than 50% of our economic model. Food is life. All societies enjoy food. Food is enjoyment. But food is equal to money also. And that's why all the marketing companies are very active in trying to mislead you about food. That's why today cauliflower is important, tomorrow eggs are more important. Today eating carbohydrate is really terrible for you, tomorrow it is not so bad, and day after tomorrow it may be good for you. Food is also controlled by religions and by governments. So when all these factors are coming into this, you have to start thinking, how can we really give people the right information about food? Let's start thinking about food recommendation engine. And in food recommendation engine, let's start thinking what are the food items, what are their characteristics, what is a person, what is the personal model, what is the context in which the person is, and based on this, like all good recommendation engines, like all navigation systems, you decide, given the person's situation, given the person's goals, his context, what he should be eating, how much he should be eating, when he should be eating. And based on this, you can give the guidance. But unfortunately, current recommendations are based only on nutrition. What we need to start considering is enjoyment, nutrition, and social and environmental factors are as important. And that's what we should be telling people. That's what we should be guiding them. So when you start thinking about this, you start thinking about this food recommendation problem as a very interesting problem that combines three different things. Here is the food items, which becomes a food knowledge graph. Here is a personal model that starts telling you what does a person enjoy and how does different food item affect his or her body and where is what available. We can take all these items and start saying that there are three major challenges and none of these challenges has been solved. We have to work on all these challenges. We have to build a comprehensive food knowledge graph. Knowledge graphs have revolutionized all other fields, but it has not been applied to food yet. We have to build personal model by tracking, by identifying how a particular food affects a person's body. How does a particular food is enjoyed by a person, and so on. And all these things will be useless if we cannot tell people that you are in this location and you can buy this food or you can get this food from this particular place or you can prepare this food by getting ingredients from these places and so on. And for that we need to prepare a food atlas. Unfortunately, all these three are complex problems, complex AI challenges. Complex AI challenges. But remember, Rome was not built in a day. Okay? So, what we need to do is to start thinking that a food system is really a tightly intertwined system of systems. It considers farming, it considers environment, it considers society, considers religious, it considers local regulations, it considers people's preferences and all those things. And using those things, we need to think how can we use AI to provide enjoyable, healthy food to all. Very recently, National Academy of Medicine came up with a report just few months ago where they identified and argued that there is a virtual cycle of health and this virtual cycle can result in enormous benefit to society. They called it a virtual cycle of healthy longevity. How can people live happily, healthy, and for a long time? And it shows that happy, healthy people result in capital for society that are different forms and that enables longevity. So this virtuous cycle needs to be implemented and this can only be done using AI. So health intelligence is essential for health. Health intelligence involves continuously monitoring everybody's health, continuously monitoring environment's health and based on this building personal models, helping them decide what is their health at current situation and what kind of health they want, and based on this guiding lifestyle using personal health navigation and including society and personal factors in guidance. A perfect problem for AI to address because without AI this problem cannot be solved and this problem is way too complex but also extremely important for survival of not only human race but also survival of the planet. Let's all work together to make this happen, to apply AI for a real good cause. Thank you very much.